welcome back to another lecture of Dental Pathshala, where we help you understand and learn dentistry better and easy. And this is a continuation of the anatomy series. Today we'll be talking about the fifth cranial nerve, which is the trigeminal nerve. Now the fifth cranial nerve has got three branches: the ophthalmic division, maxillary division, and the mandibular division. So it has got three branches. So you can remember it, tri means the three. So we have the ophthalmic division, which we call it the 5-1, or you can also say the V1 branch, which supplies the skin of the forehead and the tip of the nose. So it supplies the skin of the forehead and the tip of the nose. So this is our V1 branch, which is the ophthalmic branch. Then we have the second branch of the trigeminal nerve, which is the maxillary branch. So it supplies the skin of the lower eyelid. Along with that, it supplies the cheek area, upper lip, and the maxillary bone. So this is our maxillary branch of the trigeminal nerve, which is the V2 or the 5-2 branch. Then we have the third branch, which is the mandibular branch of the trigeminal nerve, which supplies the skin of the mandible except the angle of the mandible, including the lower lip. So this is our V3 branch or the 5-3 branch, which is the mandibular branch. So what about angle of the mandible, which is supplied by the C2? So the division of the trigeminal or the branches of the trigeminal nerve are the ophthalmic. It supplies the skin of the forehead and the tip of the nose. So in case of herpes zoster, there is vesicles which are formed at the tip of the nose, and this is a frequently asked question, that the herpes zoster infection in which there is vesicles at the tip of the nose, which nerve is involved? So that is the ophthalmic division of the trigeminal nerve. Then the maxillary division of the trigeminal nerve, it supplies the skin of the lower eyelid, the upper lip, and the maxilla. The mandibular supplies the skin of the mandible, except we have the angle of the mandible, which is supplied by the C2. Now let's see the trigeminal nerve in a three-dimensional structure. We have the midbrain, pons, and medulla oblongata. And if we remove this, we can see that the trigeminal nerve arises from the pons. So arising from the pons area, this is the trigeminal sensory root of the trigeminal nerve. The one in the yellow, you can appreciate, this is the sensory root, and one in the red, which is a very thin, is the motor root. So this is the motor root. Then we have the trigeminal ganglion also, you can see. So this is the motor root. Then there is trigeminal ganglion, which gives off three branches: the ophthalmic division, the maxillary nerve, and the mandibular nerve. So as you can see, it runs over the lateral surface of the cavernous sinus, which we have already covered in the cavernous sinus, that the ophthalmic divisions runs along the lateral surface of the cavernous sinus. So what are the structures passing from the cavernous sinus? We have studied that the structures passing are the internal carotid artery and the sixth cranial nerve. And the lateral walls of the cavernous sinus, we have the third cranial nerve, the fourth cranial nerve, and the ophthalmic division of the trigeminal nerve. 50% of the time we also see the maxillary division passes from the lateral wall of the cavernous sinus, and the ophthalmic division pass from the superior orbital fissure. So you can see the superior orbital fissure over here in the roof of the orbit. Also above the superior orbital fissure, you can see the optic canal. So the ophthalmic division, which is the first division of the trigeminal nerve, passes from the superior orbital fissure. Now you can see the first division, which is the ophthalmic division, crossing the lateral wall of the orbit, arising from the pons, the sensory root of the trigeminal ganglion. Then we have the trigeminal ganglion, and the first division is the ophthalmic nerve, which passes from the superior orbital fissure, which crosses the lateral wall of the cavernous sinus. It gives off three sensory branches. The first branch, which is present at the, see, this is the common tendinous ring. In the superior orbital fissure lecture, we have studied that the structures passing from the common tendinous ring is the nasociliary branch of the ophthalmic division of the trigeminal nerve. Rest, the lacrimal and the frontal are the structures which are passing outside the ring of the Zinn. So we have three sensory branches of the ophthalmic division. The nasociliary branch, which passes from the common tendinous ring, you can appreciate it is passing from the common tendinous ring of the Zinn. And rest all two branches are outside the common tendinous ring of Zinn, though passing from the superior orbital fissure. So you can see this is the nasociliary branch which give off anterior ethmoidal, posterior ethmoidal, and these are the ethmoidal air sinuses. The nasociliary branch give off posterior ethmoidal nerve, anterior ethmoidal nerve, and the infratrochlear nerve, which is the terminal branch. Now we have the second division. This was the most medial. So the most medial is the nasociliary, which is present towards the midline. Then we have the second branch of the ophthalmic division of the trigeminal nerve, which is going to be the frontal branch. So you can appreciate this is the middle one and this is the frontal nerve, and it also gives branches to the supratrochlear as well as the lateral branches which gives off the supraorbital nerve. So we have the supraorbital branches, which is again a terminal branch of the frontal nerve of the ophthalmic division of the trigeminal nerve. Third one, which is the lateral most part of the ophthalmic division, is you can appreciate which is present most laterally is our lacrimal nerve. So L for lacrimal, L for lateral. So this is the lateral most part of the lacrimal nerve, is the lateral most part of the ophthalmic division of trigeminal nerve, and you can also see that it is present most laterally and it supplies the lacrimal gland. So this is the divisions, ophthalmic division, which is the first branch of the trigeminal nerve. We have studied three branches: the nasociliary branch, we have studied the frontal branch, the frontal nerve, and the third division, which is lateral most, is the lacrimal nerve. So also the nasociliary branch give rise to posterior ethmoidal, anterior ethmoidal, and the infratrochlear. We have the second one, which is the frontal nerve, gives off the supratrochlear branches as well as the supraorbital. Then we have the lacrimal nerve, which supplies the lacrimal gland. So these are the sensory divisions of the ophthalmic division of the trigeminal nerve. As you can appreciate, the first one in the green is our nasociliary, which is the medial most. Then in the middle we have, so this is the nasociliary branch, which is present, which is coming from the crossing from the common tendinous ring of Zinn, passing from the common tendinous ring of Zinn. So you can appreciate over here. So common tendinous ring of Zinn, where there is attachment of the extraocular muscles. So if you can see all the three branches, lateral most is the lacrimal nerve. So the most medial is our nasociliary, which is in the green color. Then you can see the frontal branch in the yellow one and lacrimal at the other color. Second division, arising from the pons, sensory root of trigeminal nerve, trigeminal ganglion, is our maxillary nerve. So this maxillary nerve passes from the foramen rotundum, gives off the first branch, which is the meningeal branch. So the first branch is our meningeal branch. So this is arising from the pons, trigeminal sensory root, trigeminal ganglion, the maxillary division, second division. First branch it gives is the meningeal branch. So this is the meningeal branch. Then it is close to the pterygopalatine ganglion, which is present in the pterygopalatine fossa. If you can see, there is a fossa. If you can appreciate a depression or a fossa coming from the foramen rotundum. So maxillary division of the trigeminal nerve passes from the foramen rotundum, which is present in the floor of the middle cranial fossa on the greater wing of the sphenoid bone. So in the pterygopalatine fossa, we have the pterygopalatine ganglion. Functionally, the pterygopalatine ganglion is associated with the facial nerve, but topographically, the maxillary branch of the trigeminal nerve. So it gives off the posterior, superior, lateral nasal branches, as well as the pharyngeal branch, pharyngeal nerve, and lesser wing of the and greater palatine and the lesser palatine nerves. So it crosses the pterygopalatine ganglion in the pterygopalatine foci. It supplies the lacrimal gland, the nasal gland, as well as the palatine gland. So L, N and P glands. Next branch we have is the zygomatic branch. So first division of the maxillary nerve, we have studied the meningeal nerve, and then after that it is crossing the pterygopalatine fossa. Topographically it is related to the pterygopalatine ganglion, and then the third division which we are studying now is the zygomatic branch or the zygomatic nerve, and it gives off the PS and A. PSA nerve which supplies the molar teeth, then the infraorbital nerve, and infraorbital nerve passing from the infraorbital foramen, and it gives off two branches again, the MSA and the ASA. So middle superior alveolar branch and the anterior superior alveolar branch. The middle superior alveolar branch, it gives present in the maxilla, it supplies the premolars. The anterior superior alveolar branch supplies the incisors and the canine. So the PSA, posterior superior alveolar nerve, supplies the molar except the mesobuccal root of the first molar. The MSA, which is the middle superior alveolar nerve, supplies the premolars and the mesobuccal root of the first molar, and the ASA supplies the incisors and the canines. So these are the branches of the infraorbital nerve, which is again a branch of the maxillary nerve, which is a branch of the trigeminal nerve. So second branch of the trigeminal nerve is the maxillary branch. So it's coming from the sensory root, trigeminal ganglion, then the maxillary branch. The first branch of the maxillary nerve is our meningeal nerve. So this is the meningeal branch of the maxillary nerve. Then we have the pterygopalatine ganglion in the pterygopalatine fossa, which is topographically related to the maxillary nerve. Functionally it is related to the seventh nerve. Then we have the lesser palatine and the greater palatine. Also the pterygopalatine ganglion supplies the lacrimal gland, nasal gland and palatine gland. So we have the nasopalatine nerve, the pharyngeal nerve, and the next branch is the zygomatic nerve, one in the green you can appreciate. Then we have the PSA. So this zygomatic nerve you can see supplies the zygomatic arch, zygomatic bone. So it is coming from the zygomatic arch. You can see it is supplying the zygomatic bone. So this is the zygomatic nerve. Second division is the infraorbital nerve, again which give rises to MSA and ASA. So middle superior alveolar nerve and the anterior superior alveolar nerve. And behind this we have the posterior superior alveolar nerve, one in the blue you can appreciate. So posterior superior alveolar nerve is the nerve which supplies the molars. Middle superior alveolar nerve supplies the premolars and the mesobuccal root of the first molar, and the ASA we have is the anterior superior alveolar nerve which supplies the incisors and the canines of the maxillary teeth. So this is about the maxillary branch of the trigeminal nerve which supplies the maxilla, the upper lip. So guys, coming to the third division of the trigeminal nerve, which is our mandibular division. So if you can see, arising from against the pons, we have the trigeminal nerve, we have the trigeminal ganglion, and the mandibular branch or the third branch coming from the passing from foramen ovale. So this is the foramen ovale. We can see the mandibular branch, and it gives off majorly two branches, the anterior division and the posterior division, and also it is topographically related to the otic ganglion. So if you can see this otic ganglion, which is functionally related to the glossopharyngeal nerve, the ninth cranial nerve, but topographically it is related to the trigeminal nerve. So we have two divisions majorly, the anterior division and the posterior division. Before giving off this anterior and posterior branches, it gives off two branches again. So let me just make a diagram to show you guys. So guys, up till now we have studied the three divisions of the trigeminal nerve: the ophthalmic division, maxillary, and the mandibular. The ophthalmic division passes the superior orbital fissure, and it from the orbit it gives off three sensory branches: the nasociliary, which is the mesial most; the frontal branch, the middle most; the lacrimal branch, the lateral most. The nasociliary branch gives rise to posterior ethmoidal, anterior ethmoidal. Frontal branch give rise to infraorbital. The lacrimal gives rise to the lateral most, gives rise to or supplies the lacrimal gland. Then we have the maxillary branch, which is the second branch of the trigeminal nerve. Before passing from the foramen rotundum, it gives off the meningeal branch. Then it gives off the zygomatic nerve. It gives off the, before going into the infraorbital foramen, it give off the PSA branch, right, the superior alveolar branch. It also give off the middle superior alveolar branch, which supplies the premolars and the mesobuccal root of the first molar, and the ASA, anterior superior alveolar nerve, which supplies the maxillary anterior teeth, and then give off the infraorbital nerve. Now talking about the mandibular branch, guys, ophthalmic and maxillary branch are total sensory roots of the trigeminal nerve, but we have a motor root in the mandibular branch. In the beginning, I have showed you a very red color thin motor root which is running along with the sensory root of the trigeminal nerve, which passes from the foramen ovale and gives off two branches: the meningeal branch and nerve to medial pterygoid, which supplies the medial pterygoid muscle as well as the tensor tympani and the tensor palatini muscle. Then it gives off two branches, again anterior division and the posterior division. So anterior division is mostly the motor, the posterior division is mostly the sensory root. So the anterior division supplies all the muscles of mastication, which includes the mesenteric, the deep temporal, nerve to lateral pterygoid. If you remember, nerve to medial pterygoid, which supplies the medial pterygoid muscle, which is a muscle of mastication, is again from the undivided root of the mandibular branch of the trigeminal nerve. So medial pterygoid, it supplies to the medial pterygoid before dividing into anterior and posterior division, but after dividing into anterior and posterior division, it supplies rest of the muscles of mastication, the anterior division, which is mostly motor, except one, the buccal branch, which is a sensory part. Then we have the posterior division, which is basically the sensory root, which is again divided into the auriculotemporal nerve, the lingual nerve, and the inferior alveolar nerve. Inferior alveolar nerve again divides into the mental nerve and the incisive nerve. So this is about the mandibular branch of the trigeminal nerve. We have also seen in a three-dimensional structure all the roots, and let's revise it again. The mandibular branch, it has got two roots, one motor root, another sensory root. Rest of the division of trigeminal nerve has got only the sensory root, but the mandibular branch is a mixed which contains both motor and the sensory root. So motor root, which is in the middle cranial foci, passes from the foramen ovale, gives off the first branch, the meningeal branch, then the medial pterygoid nerve, which supplies the medial pterygoid muscle. Then it's divided into anterior division and posterior division. So anterior division, which is majorly the motor, supplies the rest of the muscle of mastication except the medial pterygoid muscle, because medial pterygoid muscle is already supplied by undivided branch of the mandibular division of the trigeminal nerve. Then we have the posterior division, which is mainly the sensory, the auriculotemporal, the lingual, and the inferior alveolar. So we have studied in the ophthalmic division there is ciliary ganglion, which is topographically related to C. Remember, T for trigeminal, T for topographically. Topographically related to the ophthalmic division of the trigeminal nerve, while functionally it is related to the third or the oculomotor nerve, which is in the first branch. Then in the second branch, which is the maxillary division of the trigeminal nerve, we have studied the pterygopalatine ganglion in the pterygopalatine fossa. Which is functionally related to the facial nerve and topographically related to the trigeminal nerve, which is the maxillary branch of the trigeminal nerve, and it supplies the LNP. So the lacrimal gland, the nasal gland, and the palatine gland. Then the third division of the trigeminal nerve, which is the mandibular nerve. There are two ganglions which are related. First one is the otic ganglion, which is functionally related to the ninth cranial nerve, the glossopharyngeal, topographically related to the trigeminal nerve. So T for topographic, T for trigeminal, which is the mandibular division of the trigeminal nerve. So it supplies the parotid gland. We also have the submandibular ganglion, which supplies the submandibular gland and the sublingual gland. So functionally it is related to the facial nerve. Topographically it is related to the trigeminal nerve, which is the mandibular division of the trigeminal nerve, or the lingual branch to be very specific. So most frequently asked question is, which of the following nerve is from the divided or the anterior division of the trigeminal nerve, except, so in the exception you will see nerve to medial pterygoid, because it is from the undivided branch, it is not from the anterior division of the trigeminal nerve. So remember that in the mandibular branch, so this is, say suppose this is the mandibular branch, so after passing from the foramen ovale, it give off the first branch, which is our meningeal branch. Then it gives off one more branch, which is the nerve to medial pterygoid. Then it is divided into anterior and posterior. So anterior division is mostly the motor, posterior is mostly the sensory. So anterior division gives rise, supplies the muscles of mastication. Posterior division, it gives off auriculotemporal, and the inferior alveolar nerve. So this is the mandibular division of the trigeminal nerve. In the anterior division, all the muscles of mastication are motor except the buccal nerve, which is the sensory. And inferior alveolar nerve has got both sensory plus motor. So mandibular branch of the trigeminal nerve is the only branch of the trigeminal nerve out of three which has got both the sensory and the motor. Rest, the maxillary and the ophthalmic, has got only the sensory fibers or the sensory root. So guys, this finishes the trigeminal nerve. I hope that you have enjoyed this lecture. So if you have enjoyed it, give it a thumbs up. Also comment in the comment section below, because this motivates me to put more videos for you guys and to make free notes which are available on the website. You can also check out our website www.xtute.com, or you can check out the link provided in the description box below for the free notes of this particular video lecture and more interesting notes like this. So till then, keep reading, keep learning, stay motivated. I'll see you soon in the next lecture.